Progesterone is the next hormone which we'll be talking about. And now, if you are talking about the hormones for women, anytime they talk about estrogen, the next one they always mention progesterone, right? So you could confidently say this is like the second most important hormone to a woman. So for progesterone, you will say that what is a vital hormone in the reproductive system. It's often called hormone of pregnancy, okay? Because its key role in what's preparing and maintaining the uterus for a fertilized egg, right, is a role that is what's mostly recognized. So in females, progesterone does a lot of work. It prepares the uterine lining for implantation. It supports early pregnancy by maintaining the uterine environment. It prevents further ovulation during pregnancy. That's why when you are pregnant, there's no menstruation. Okay, so it suppresses uterine contraction to avoid preterm labor. Helps breast to get ready for lactation. How about in males? It's produced in small amounts by the adrenal gland and testes, plays a role in sperm development and hormone balance, right? So let's talk about the role of this progesterone in the menstrual cycle, which is like the key role of it. So after ovulation, the corpus luteum is a temporal gland formed from the follicle, produces progesterone. So if pregnancy occurs, progesterone levels rise and the corpus luteum continues to function. If there's no pregnancy, progesterone levels will go down, triggering what? Further menstruation. Do you understand? So that means once there is pregnancy, progesterone levels are so high, no menstruation. So that's just how that thing works. So these are the various levels you can actually find progesterone at different stages of a woman's life, right? Follicular phase, luteal phase, first trimester of pregnancy, second trimester of pregnancy, third trimester of pregnancy. Now you should know that every number you see here, the value is what? Nanograms per ml. Okay. So if there's low progesterone in a woman, there's irregular periods, there's difficulties conceiving, there's mood swings. Okay, there's also mood swings, there's fatigue, there's hot flashes, there's increased risk of the woman having miscarriages or ectopic pregnancy. So if progesterone levels are so high, usually safe during pregnancy, right? Rarely linked to any disease condition, right? So it's used in hormone therapy, right, and birth control, right? Where if you give it to a woman, it will now mimic as if the woman is pregnant, so no ovulation. Do you understand? It will stop unwanted pregnancy. So that's it for progesterone as a hormone.